everyone. Hi. Lunchtime, so I'm not sure if this is a great time of the day to present. I will try to keep it to the time that is offered and look forward to any questions. My name is Shripriya Rao, part of the founding team of Karkinos Healthcare. We're now a step-down entity, 100% step-down entity of Reliance Industries. And prior to this, I have had close to 2 decades of experience with Tata Consultancy Services as business transformation consulting head for organization change for Asia Pac, India, Middle East, Africa, some parts of Europe. So I'm really happy to be here amongst each one of you. I spent about 2 decades. I was, in fact, happily working at TCS. At the time, I went through a certain personal journey with my own father, going through cancer. And in India, I'm sure that somebody in your family, somebody in your friend circle, you would have seen going through a particular journey with cancer. And the experience with respect to treatment is something that is very different if you go from one hospital to another, one doctor to another. And if you were to be in a metro city versus if you were to be in any other local tier 3, tier 4 locations. So one of the major challenges that we are solving for at Karkinos is to, in fact, bring affordable, accessible care closer home, and how do we drive this as part of the entire technology roadmap. There's a joke that, people have gone to the Mars and yet come back, and medical records cannot travel from one hospital to another. It's just so unfortunate that we are here in terms of the dealings that we have in the country. So I'm going to give you a glimpse of what's the cancer care setup. Not sure how many of you are aware, but they say 1 in 4 very soon will have cancer in the country. That's scary. Yes, I see a lot of eyebrows. That's scary. And that's the kind of numbers that we see World Health Organization and others coming about. And majority of the cases are late stage, and not much that you can do essentially with respect to being able to provide any curative solution to all those patients who come our way. So how do we solve this? Because 70% diagnosed late stage, and you got so many cancer incidences increasing in the country. And yet what you see, other than very, very few hospitals, there's somebody who's taking care of diagnostic. You've got so many diagnostic centers, but they want to offer you treatment. The treatment in some hospitals is half-baked. Some will give you a certain solution, but for certain parts of diagnostic, you have to reach out to any other center. There are others who are only taking care of early detection, doing some camps based on when they have the time, but not focused on prevention as one of the major areas of criteria. So it's quite a fragmented approach that you see. You're all in Bangalore, of course. There's Manipal, Aster, there's Narayana Health. There are so many others who offer for treatment. But if any one of you have visited Mumbai, you see 300 new cancer patients in Tata Memorial even today. And if you see the rows of cancer centers at Tata Memorial, there's so many people on the roads. It's quite a scary scenario. You got people from Manipur, you got people from other parts of India, all coming there to see how their problems can be solved. So our idea was, how do we really bring a technology solution to be able to drive a roadmap towards this? Not sure, we have so many women here. I don't know how many of you know that there is HPV vaccine that you must take to be able to avoid yourself from cervical cancer. Now, people think this is a disease of the poor. That's really not it. I, in fact, had one lady who was part of her corporate setup who recently, about 2 days ago, said her mother succumbed to cervical cancer. Every day, 1 in 8 women is diagnosed with cervical cancer. It's still the second most common form of cancer for women in India after breast. So, but did you know that there is a vaccine? And there is a test that if you were to take this test once in a lifetime and detect it positive, within 15 minutes of OPD procedure, you could be treated. So while you have simple solutions, there's lack of awareness, lack of technology, available access that you can be provided with. So our idea at Karkinos was, how do we bridge this gap? How do we bring technology? How do we bring solutions for India to the masses of rural, to tier 3, tier 4, as well as make sure everybody is able to take this entire roadmap? So we are providing an end-to-end solution, starting from detection with a major focus on prevention, and also looking at democratizing diagnostics. In India, we still do a lot with respect to biopsies and pathology, which is absolutely basic, but there is a lot that West is progressing with and moving towards molecular technologies and others, more not just looking at the morphology of the disease, but looking at genomics, looking at the entire bioinformatics behind the genetic mutations and then moving forward. But in India, unfortunately, this technology is extremely expensive. So we're looking at how to bring this as a more affordable care to India. And also, if somebody were, now, not sure how many of you know the demographics of Karnataka, but if someone were to be detected in Gulbarga but needed a care, they all, like entire family, get shifted to Bangalore, their livelihoods lost. How do we bring distributed care network in Gulbarga where at least non-complex treatments can happen? The records can move to Bangalore when needed and move back. And then how do we provide a solution in terms of distributed cancer care network? So I'm going to talk a little bit about what we do in each one of this space. On the detection side, which is one of our major areas of focus, we look at providing for API solutions and look at elevated risk assessments. Does anyone in your family have signs and symptoms of cancer, any family history of cancer? Look at curated methods. Common forms of cancers you can easily diagnose: oral, breast, cervical, colorectal, prostate. There are ways and mechanisms to know them early than have to know them in stage 4 or stage 3. So we have created an approach which is also connected to the Government of India's ABDM platform, as well as the Ayushman Bharat's digital mission with ABBA ID connectivities, and we've been able to do more than 1.4 million risk assessments to know who's at elevated risk and then move ahead in this particular journey. So we do screenings for large corporates, villages, with working with NGOs in a more impact-based approach so that we can go ahead and screen more people, both men and women, to be able to identify them early. We talked about diagnostics in India. Today in AIIMS in Delhi, as well as in some of the other parts of the country, you do have diagnostics, but not a lot of them are moving towards genomic storyboard for the country. And if you were to look at molecular technologies and others, quite expensive in India. So we've built about 30% of genomic capacity for the country so that we can provide for care much easier. In HPV, we have a FDA-approved platform, the HPV DNA testing, which is one of the 600 tests that are available in the country. Not sure how many of you know. You may be taking a lot of diagnostic tests. Go ahead, get a diagnostic partner, come home, do some blood work. But how many of us go ahead and check whether the platform that they report out of is a validated platform or not? We actually don't bother to check those details, but there are 600 HPV diagnostic tests that are in the country, but several of them are unvalidated. They don't have enough data to say whether or not the results that come to us are validated. So one of the major criteria for us is how do we go ahead and look at a problem solution which gives affordable solutions but yet are validated solutions to the people and the women of the country. That is what we have as part of the Roche Cobas 6800 platform. That's an FDA-approved WHO pre-qualified platform that we picked up. So several of these that we've built is something which is not easy for us to replicate, but yet at the same time, investments made to be able to provide them in an affordable model. And people don't have to come all the way, but the samples travel. So you necessarily don't bring a technology to the place where the people have to get to that particular lab location, but get the technology to enable the transportation of the samples, cold storages. Today, if you get blood work to travel for genomic sequencing and others, it's cold storage technology that you have to work towards. But there are newer and newer methods that are coming up where if you collect a sample in a tube, it can still be good at room temperature, and the DNAs and the RNAs can still be okay for almost 14 days at room temperature. But validating some of those, making sure you have a research roadmap which is ethics approved, which is with informed consent of people, all of this is something that we are working towards. There are several others in the similar lines, the Illumina platforms for genomics, the NovaSeq, PacBio, the first in the country, I think, where we are doing some work with Harvard Mass General, as well as some of the Mayo Clinic professionals and others. Our entire roadmap is based on a technology platform which is open source on cloud to be able to connect. If, let's say, I were to go ahead and screen myself, I look at all the screening techniques, and based on if I am suspicious to a certain form of cancer, assume for a second that there is something that is suspicious in terms of a mammography that I have seen, we should be able to do AI ML on those and be able to detect them, and also those records. Today, we have a mobile medical unit in Nandyal, which is about 6 hours from here in Bangalore, which has a mammography device on a bus, which goes to the villages where rural women can go ahead and actually get themselves tested. The images of that go to the cloud, and a radiologist in Manipur looks at those particular images and reports them back. So you don't necessarily need methods where you need to have a person in that particular location, but technology can, in fact, solve this problem at scale. So many, many other such solutions, but I want to talk about one such. And the point that I'm going to put forward is quite scary, but just hear me out. If you went to a surgeon today for a particular disease, they will offer surgery. If you went to a radiation oncologist, they will say radiation first and then surgery. If you went to a medical oncologist, they will say go ahead and get a chemotherapy done first and then something else. That is the reality that we see in India today. Maybe not 100% in this manner in all the locations, but largely this is what we see in majority of the locations. Our idea was, how do we make sure whatever pathway the clinicians were to put forth is clearly validated. It is based on a clinical decision support system which has the pathways which are nationally, internationally approved. So there are pathways which NCCN guidelines in the US or the UK and NICE guidelines, physician data query. In India, I don't know how many of you know, every clinician should follow a national cancer grid pathway in terms of treatment protocols. But we have centers, more than 60 centers across pan-India. If I have a doctor in Kerala, if he is to provide for treatment, how do I ensure that his treatment protocol and plan is the same as what I have for a treatment center in Manipur or a Kolkata or otherwise? To be able to do that, we've created a clinical decision support system. If some clinician is to put a pathway which is outside of the pathway that is defined by the national guidelines, they are supposed to, in fact, state why the deviation and how to take it forward. So there are many more in terms of the virtual tumor boards and others. They are just a simple case study, but an important one that I wanted to highlight. An oral cancer citizen. We identified the citizen in one of the villages where we were screening for. The images is something that you can, in fact, see and be able to say whether or not he has any tumors or others going ahead. And the images travel on the cloud. The patient does not need to. We take a biopsy at the village location and be able to send the biopsy to a lab which is at least 300, 500 kilometers away, and then be able to bring them back as part of the journey. So what you see in the last picture is how the samples or the technology sort of enabled it. But the patient or the citizen, in fact, did not have to move. And you have all the images on the cloud where the radiologist or the clinicians are able to see through it. And we've been able to perform the surgeries in a L3, as we call a center, which is closer home. So the citizen does not have to travel to a complex location. One of the major things that we're doing as part of our delivery of care, we today have comprehensive centers majorly across the country. What you see in a Tata Memorial or a Aster-like center or a Manipal hospital here or an H, they are mostly like the L1 Apex centers, but you don't see similar centers across other districts of India. Government of India, in fact, as part of this time's budget, came about a nice roadmap with respect to 100 daycare centers across the districts, but that doesn't solve fully the issues that we have. And we have essentially been able to look at, building on the same model that Government of India is looking at. We have those L2, L3, L4 centers. Tie a multi-specialty, a normal nursing home, a gynecologist, a dentist of the country to be able to also look at cancer care. Because it's really primary physicians, family physicians who take care of this subject and not necessarily the complex disease. And build that on a platform and bring it to a particular roadmap for precision oncology. At the same time, when you treat a patient who's essentially at a roadmap, you don't know whether some of the drugs work for them or not. Not sure. I did not have knowledge of this, but majority of the drugs that we have in the country have been validated for Caucasian population, for a very small percentage of number of people that it has been tested for. How do we build something for India? So looking at chemotherapies, responders, non-responders, how do we go ahead in that journey, and towards which we've been working and have now got a patent and clearly put a roadmap towards looking at responders, non-responders for chemotherapy for cervical cancer. And if somebody was resistant, how do we move forward? So the idea is to move away from the traditional models and be able to create a platform which is, in fact, giving hospitality as a concept than hospital as a concept for the patients, and at the same time go ahead and have somebody at a command center tell you what is the next that you need to be working towards. Because when you go to a cancer center, you actually completely blank. You don't know exactly what to expect. What is the next step? If you had to get an MRI or a PET CT, what is the roadmap? What are some of the side effects? So a command center which also has multiple languages where there are counseling methods and others to be able to take care of such a journey is what we're looking at. So I want to end by saying that, it's not like what you see on the top of the iceberg is what is always real. There's so much more to it. Healthcare has a long way to come. I've been part of so many technology transformations in financial services, retail, autonomous vehicles and others, but healthcare has a long way to go. There's so much work that researchers have done, but there is so much more adoption that has to happen, that people need to know about it and be able to take forward. And which is what we are working towards in terms of bringing precision oncology to an everyday roadmap. So I have 3 more minutes, so I'm happy to, in fact, take questions and try and close this at this point. But my urge to everyone is learn to understand the newer technologies that are available, newer methods that are available in healthcare. Also check for, are we looking at validated tests in the market and not just going ahead and testing ourselves with just about anything. And if you have not taken an HPV vaccine or an HPV test, depending on what age bracket you are in, please do take, because it can actually make a huge difference in your entire roadmap with respect to cancer prevention. So I pause it here. Thank you.